Okay, so thanks so much for joining us tonight for this webinar about exercise and your health. And I'm Dr. Sonia Doherty. I'm a naturopathic doctor. We're actually right below the gym. So we're at the clinic now. So we saw lots of folks go in, and we're both members of the gym, and so is my daughter, and so is my mom. And we feel really lucky to be on today. So my sister, Dr. Krista Doherty, is also a naturopathic doctor. And she's going to be talking a lot about the hormone piece because I don't treat adults. So what I'm going to focus on today is something that I hope you find really interesting, and it is very, very fundamental to everyone's health, whether you're a baby or you're 100 years old. So I'll jump in with that. And let's see here. So what I'm going to talk about is methylation. And I would love if you guys could, because I really want to make the most of your time here. So I don't know if you guys could let me know if you've ever heard of methylation. Can you just give me a show of hands? Or I don't know if you guys are into these little reactions over here. There's like, you can show me a reaction, raise your hand. I'll answer even if you don't raise your hand though. My issue now is I don't know how to stop raising my hand and making these funny things. So that might stick for the whole time. But okay, so methylation is something that you may not have come across, but it actually impacts your health every single day. So I have a presentation that is going to seem confusing at first because it's going to say autism, but actually I don't treat a ton of adults, but I am an expert in methylation. So this was a PowerPoint actually that we made for China. Chris and I were asked to go. Well, I mean, I was asked to go to China, and Chris.
I scammed a trip. I'm like, I'm going to.
Well, actually, the story goes like this: is that I was asked to go to China to talk about autism. And then I got on the phone with the PhD neuroscientist who was doing the conference. And I talked a little bit about Krista. And of course, by the end of the conversation, she wanted Krista to come too and made her a keynote speaker. So methylation is really fascinating, and exercise improves methylation. Exercise also improves genetic expression. So I want you guys to understand that, because I want, when you're, whether you're on the treadmill or you're Stairmaster, you're doing weights, every single time you are exercising, you're improving your genetic expression, and you're actually protecting your genes, and you're helping yourself live longer. And a lot of that happens because the methylation cycle is improved. So I'm going to move us up here. The simplest way for me to describe methylation is with these wheels. So methylation is when cells from mom and dad become a human baby and turn into, all the different organs within our body. Methylation makes all the nerves, methylation makes all the cells, and in the event of damage, methylation repairs the body. So methylation is essential to human health, and unfortunately, we're so surrounded by toxins that methylation is constantly under pressure. And so something like regular exercise continually improves your methylation. So these two wheels, sometimes I describe them like a bicycle. You can imagine it's like the bicycle of health. If it's moving forward, you're staying healthy. If it's slowing down, you're putting yourself more at risk for problems with immunity, your stress system, dysregulated hormones, disrupted sleep, and even things like Chris and I call the big scaries, right? The chronic diseases, things like cardiovascular disease, metabolic syndrome, diabetes, cancer, Alzheimer's, dementia. And all of this relates back to certainly your exercise level, but what your cells are doing. So this pink wheel is the folate wheel. If any of you guys have had kids, probably you were told to take folate while you were pregnant, because folate is essential for cellular function. So this folate wheel actually takes folic acid that comes in a synthetic form and folates, which come within our diet, and it converts it into an active folate. So active folate is essential for your cells to function properly. Active folate gives you energy, right? I don't know if you've ever had a green smoothie and you feel energized, a lot of that is what is happening to the methylation cycle. The same thing happens after you exercise. And it's really interesting because some of the mechanisms of exercise are well understood and some of them are more poorly understood. But this methylation improvement transforms the way your body feels. And that actually lasts for weeks and weeks. If you're exercising regularly, then you get to experience those benefits ongoing. So this green wheel is the methylation wheel. This runs on B12. That's why a lot of athletes will actually use B12 to enhance their performance. B12 is used by lots and lots of elite athletes to improve their endurance, to improve their strength of their muscles. B12 is also used to prevent things like concussions or chronic traumatic encephalopathy, things we see in some of the sports world with those chronic concussions. So methylation is being studied from exercise to gut health to hormone health. And so if you can improve it through regular exercise, just like diet and just like good sleep, these are fundamentals to health or foundational for your health. So what slows this methylation cycle is stress, problems within your gut, toxicity, things like lead, nutrient deficiencies, so zinc. Let's take the example.
I'd really like to get rid of this. Oh, there.
So let's take COVID for an example. Just a reminder, if you guys can mute, it's down on the lower left side. Just mute out so we can not have the background noise if possible. Thank you. The COVID, for example, actually depletes zinc. It depletes zinc on quite a significant level. So if you've had COVID and you've had post-COVID issues, you've actually slowed methylation. And so exercise is really important, but you can also augment that by understanding how the methylation cycle works, right? It needs active folates, needs lots of green leafy vegetables. It needs less carbohydrates, which I'll explain in just a minute. And it needs lots of good vitamins like B12, zinc, even things like beets. They contain something called betaine. Onions are methyl donors for the methylation pathway. There's a really interesting study that they did about these rodents, and Chris, I don't know if you can find the name of them. It's a really funny name, but they genetically engineered these rodents to actually have increased risk for diabetes, and then they use them in research, right? And when they gave these rodents, keep in mind that they were really at risk for things like heart disease, diabetes. When they gave them methyl donors within their diet, it dramatically reduced their risk of getting those diseases, even though they were genetically predisposed. And so diet, sleep, and exercise can transform your health no matter what your genetics are. And that's why they're so powerful. So I'm going to circle back to the synthetic folic acid that we find within our grains. Lots of naturopathic doctors or health coaches, maybe even trainers, talk about the benefits of reducing complex carbohydrates. The mechanism that relates to methylation is about folic acid. Complex carbohydrates are synthetically fortified with folic acid. So your body actually has to take synthetic folic acid and convert it to allow this bicycle of health to work. And so if you find that you're more sluggish, you have lower energy levels, Chris is going to touch on the hormone piece, you can actually use diet to leverage the power of your methylation cycle. And I haven't even touched on the rest of this slide, so I love this slide because I can talk about it all day long. But these two cycles actually provide methyl donors to 200 other pathways. And while I'm not an expert in all those pathways, because some of them are very related to long-term chronic disease and things like hormones, it's really fascinating how important the methylation cycle is to mood. Okay, so out of these 200 pathways, some of the most important pathways are the production of serotonin, and the production of dopamine, and the regulation of stress in the brain. And so without your methylation cycle working robustly enough against toxicity, against stress, against nutrient deficiencies, and also trying to convert this synthetic folic acid, you get a slowdown in methylation, which actually makes it harder to repair the damage within your body. This can relate to injury. It can relate to fatigue. It can relate to pretty much anything because this is a foundational pathway within the body. So folic acid slows this cycle if you can't metabolize it, which many of us can. So it's estimated that up to 70% of people actually have trouble metabolizing the synthetic folic acid within the grains. And to speed up this cycle, you add green leafy vegetables and you reduce the complex carbohydrates. To speed up the methylation cycle, you add things like zinc, beets, onions, leeks, garlic, B12. And then when these cycles are working, you're going to pass that methyl donor onto 200 other pathways. The last thing I'm going to touch on, I think before I hand it off to Krista, is mitochondria. And I think lots of us probably have heard of mitochondria. Mitochondria are in the literally hundreds of trillions. Like I don't even know if we could count how many mitochondria our body have. Mitochondria are the energy production factories within our cell. So mitochondrial medicine or improving mitochondrial output is really interesting in the realm of exercise, both for performance and prevention of injury. But methylation actually requires mitochondria to work properly. And mitochondria really do well with more fats. So when people talk to you about making sure you have healthy fats in your diet, there's, again, lots of reasons for that, but on a cellular level, your body needs fats to actually produce energy that runs all your cells, all the methylation in your body. The other part about fats as it relates to things like mood, and of course, when we think about mood, lots of us will think about serotonin and dopamine. Those are two brain chemicals made by the methylation cycle. Serotonin and dopamine have to be packaged in fat. And keep in mind that your brain is 2.5 pounds of fat. So when we want the body to work at its optimal, fat has to be part of that strategy. Just to kind of, I mean, everyone's sort of probably coming in with a different understanding of things like serotonin, but if someone did suffer from anxiety and or depression, they're often put on medications that increase serotonin and or dopamine within the bloodstream. They don't make more. They keep it in your bloodstream so you feel better. You can actually use methylation medicine to improve your own production of serotonin and dopamine, and that doesn't interact with any of your medications. I am going to come back to serotonin when I talk about the gut, but my sister, I always say she's my forever boss because she's my older sister and she runs the clinic, so she told me I had to go first. But do you want to touch on methylation at all, Chris, as it relates to maybe hormones? Because I could do the glutathione piece too.
Let me do the hormones, and then the glutathione piece will be more relevant. You
Excellent.
need to give me permission to share, because I don't have any control, and I like control.
Yeah, I don't like doing that. I like
I
to
know.
I like because
I know. I want the screen.
I know. It's hard for me to give it up though. All right. Okay.
I got it.
I'll pass the baton.
All right. So let me see if I know how to do a slideshow. Play from start. All right. So what we typically know for exercise is the general cardiovascular risk is a very big killer. It's also there's things like the diabetes, hypertension, high cholesterol, obesity, those factors. We know exercise is very, very important with those, but that has been true for a long time. So I think what Sonia and I want to do is give you the deeper piece and the things that we can, what we find is more interesting. So the exercise piece that we're really interested is this smaller lens. So Sonia went through the methylation and she'll go through the microbe a little bit. I'm going to skip to hormones real quick. See this this big old chart. These are the two circles she was talking about. So this is the which one's the pink one? This is the pink one, the pink wheel, and this is the green wheel. And this here is the Krebs cycle, or did I get it mixed up? You can't, your volume's off.
Sorry, this is the pink wheel, right?
Which one? The one on the right or the left?
This, not that one, the other one.
This one's the pink wheel, this is the folate wheel, and this is the B12 wheel right here, because B12 is cobalamin, and actually B12 is red, so pink makes sense. That makes so much sense now. And the more you crank this pathway, the more you make things like glutathione, which we'll talk about in a sec, and the more you'll get the Krebs cycle. That's energy and ATP, that's energy inside your cells, and that's inside the mitochondria. So I'm visual, so I like to sort of visually see like, hey, if I put more energy in this system, I get more energy here. And the same is true for here. If you can see this really, really small word right there, that's serotonin. So these two areas here crank what we know as of energy and ATP in the system this way, and then they would crank the production and the evening and the balancing out of the neurotransmitters. So that is the methylation pathway with a little bit of an extended diagram. You don't have to know it all. I know you can't probably see it, but when we're looking, like those are on our walls. So when we look at a case, we always see where are you in the methylation pathway? And now I'm going to talk about it a little bit as it relates to hormones. This is just saying a little bit about how it cranks. It pushes and it's like a bicycle wheel and it cranks and it will push the body and get more energy and ATP. It can actually be roughly estimated by creatinine levels. So there are ways you can actually judge your efficacy on the methylation pathway, but we also like to look at hormones. So way up here is cholesterol. And I don't know if you knew this, but cholesterol actually converts into a base hormone called pregnenolone, and then pregnenolone splits three ways. The pink area is the stress area. That's where your energy goes into cortisol and manages your stress system, which is not a bad thing. It's a necessary thing. Then the cholesterol converts into hormones that are testosterone based, and that's regulates our muscles and our testosterone based function. Obviously, mostly we're women here. Women will convert most of our testosterone as to estrogen. And then there's different estrogens that get made, and then we break them down and get them out of the body. So this is a flow chart of how hormones are actually quite related to each other. And they're related to each other through the methylation pathway because the hormones convert from downstream into each other. And then they're converted and they need energy and methyl factors to cut them up or create more factors. So when we're looking at hormones, we're also looking at the balance. Like, do you tip into the pink area, which is the stress area? Or do you tip into the yellow area and you're kind of your testosterone is kind of stuck a little bit and you're not making enough estrogen? Or are you depleted all the way through and you're just kind of like dehydrated with fuel and you're not making enough power to sort of fuel stable hormones? And in that case, we give you more fuel, and that's when we slide back to the fats. So no matter what your age, you need good you need good omega-3s, omega-6s, and even omega-9s to make your core hormones. And you also need it to lubricate things. So when we're looking at power and control and function, we also look at energy markers. So there is a research on what's called a fragility index, and it actually is indirectly looking at health markers. And these markers can be looked at in blood work. And the more information you put in, like, you know, your weight, your belly fat, your ability to function, your cognitive aspect, you know, how much you can physically do, how well you sleep, all of those are fragility markers. Some of them are quite well known in blood work, and some of them give you a total idea of health markers. So when you're looking at fragility markers, there's a lot that can go into it, but even simple blood work can help you figure out the health piece when you're looking at, you know, am I strong? Am I not strong? When you're looking at the methylation pathway, it's not really about how good your exercise is necessarily. It's about how stable your energy system is. If you're running out of fuel and you choose to exercise with all of your fuel, you're not getting the most out of your impact. You want to make sure you're not nutrient deficient as you're exercising, you know, 10 hours a day. I'm exaggerating, but there's a cost to exercise you don't want to have to pay. You want all the benefits of exercise without the downside. And sometimes your health markers or your fragility markers will tell you, look, you're doing well, or you're running low in these pathways, and there's a cost you don't want to bear. So even things like neurotransmitters and mood can actually be tested. Oh, sorry, this is the hormone pathway report. So when we're looking at the back, there's not just one type of estrogen in a woman's body or men's body. There are multiple types of hormones, and depending on where your methylation pathway is supported, your body will either make good hormones or it will stick itself into the production of sort of inflammatory estrogens. And sometimes we actually use these type of tests to figure out, oh, you know, look right here, this person is making a high normal of this 4-OH estrone, which is not as even as the other parts. So what we're looking for is midline numbers. And when we see a story where everything is low and then one thing is off the charts, that area is jammed. And then that's our job as naturopathic doctors to figure out how to lubricate or unjam that area so that the rest is balanced and we can find a normal value for hormone regulation. So the methylation piece is about the formation of good cholesterol, because that's at the top of the hormone production piece. And it's also about things like good HDL, and HDL is our good fat. It takes fat away from the heart. It also helps make our good hormones. And hormones are also going to help balance our neurotransmitters for mood. Even cofactors like choline will help recycle hormones like estrogen and increase the strength of the body. They will do other things like help liver support and increase blood support. And we always sort of want to check on our stress system. So there's a combination called the pregnenolone steal, where all the energy you're putting into the system, all the vitamins, minerals, the great food, the great exercise you're doing is actually pushing and making high cortisol, which is not okay. But that's actually, it's easy to see in blood work that your body is kind of tipping stage left. And instead of making even hormones, your body is kind of getting jammed in the stress system. There are other contributing factors. There's some people who have low-level fungal infections, which are actually kind of common. Those factors will deplete things like B6, and B6 is needed to cut up hormones and balance them. When we're looking at our cells, we always want to make sure you have good, strong fuel, because it makes a difference in a lot of different factors. So we'll talk a little bit at the end about different cofactors that can, or nutrients that can make your exercise more efficient. But hormone regulation is primarily about the fats. and the B vitamins. And if you're deficient, it can very much kind of go awry. This is my rough drawing of blood sugar. So we do have times where blood sugar is making bad choices. And this is my attempt to draw a blood vessel, which is a bit rough. But when we're looking at diet and hormone regulation, there is a piece that combines. So for example, sugar or glucose isn't necessarily a bad thing. Sometimes it can be something like broccoli. When you're eating glucose, your glucose has two options. One, it can go into this area right here, which is the bridge, or insulin, which will hop into the cell and give your body energy. So broccoli gives your brain energy. That's good. That's the good direction. When the body makes bad choices, the glucose molecule will bind to the red blood cell and make a complex called glycosylated hemoglobin, or rock candy, bad. So HbA1c measures this rock candy, this very corrosive, sharp complex, which has essentially destroyed your red blood cell and destroyed your sugar molecule and made this kind of like barbed wire complex that will cut the inside of the cardiovascular system. So bad. What the body will do, especially if you're a woman, is anything to get it out. And women will dysregulate their hormones in attempt to get it out. So if you've got high estrogen, if you've got low estrogen, it doesn't matter. Your body is going to try to convert, your body's going to pull the HbA1c or pull the glycosylated hemoglobin or the rock candy out of the vessels through converting your estrogen into an inflammatory estrogen. So this is what we have. Yeah.
Well, what does that look like from a condition standpoint? Like, are we talking painful periods, lots of clots, PCOS, endometriosis, fertility issues?
Yes. So well, this condition is just really testable in blood. So if your glucose levels are okay, like your fasting glucose is great, but your HbA1c is starting to get a little out of control, you're going to have a hormone dysregulation. Men actually keep all their drama inside the pipes, and that's why they're more at risk for cardiovascular issues. Women, our estrogens will share the burden with us, causing hormone dysregulation. Now, you may not know that it's happening. Your body, like I've got some fat on me, so I can cushion some of my dysregulation I just get fatter, like it goes on my bum. And that's okay. It's just that the inflammation or the dysregulated estrogen has a cost to it. So you may just not be, you may not know that your estrogen's, inflammatory. It could be just you have belly fat and you don't want it, and it's a tough time exercising. So you're saying, I'm doing a bad job exercising, I'm doing all this work, I'm not getting as skinny as I want. Well, sometimes your body's trying to protect you. And this is one of the mechanisms that does that. So, be gentle with yourself and have expectations, but also sort of be very aware that you're not, you don't live in a bubble. Like we do live in probably the third most toxic area in North America. We have a couple of mentors that will tell us, that our patients are just very interesting, because we live in the escarpment will give us almost this little Mexico type of barrier where we get Sudbury Superstack, Chicago trade winds, Detroit winds, they actually dump in the escarpment area and they get stuck like right where we are. So we experience a little bit more toxicity than, say, even Toronto, which is interesting because Toronto is bigger and more toxic than us. So that toxicity has a cost, and it can jam up your blood sugar issues. So long story short, I like blood work because I think it tells a story, but I think your body, your body better than I do, or your body well. But just if your body isn't responding like your trainer is telling you, or like you have expectations of it, sometimes there's medical reasons why it's happening. And this is just one example that you can check in blood to say, is my blood sugar responding the way it should, knowing that extra little piece that hormones have an involvement with the blood sugar piece. My picture should get a lot prettier, but maybe when I become an artist, my second life.
Mhm.
So the thyroid function is interesting because thyroid does a lot of different things. These are some of the jobs that thyroid does. We do know a lot about thyroid metabolism being a big job, just because we think about hypothyroidism or low thyroid function, and we think about people being larger. What we see in practice is subclinical hypothyroidism. So we see a lot of people who, I'll show you the slides next, but they're really convinced they have a thyroid condition because they're like, I'm cold, I have dry skin, I'm constipated, my hair is dry, I can't lose weight, I'm sad. And so they say, I think I have hypothyroidism. And I said, okay, let's do your blood work, and your blood work looks okay. And the person's convinced. And I think actually sometimes they're right. So what we find is that inside cells, every cell in the body has DNA, and that DNA is activated or stimulated by thyroid hormone. So when we look at thyroid function, we can see that it does body temperature and it gets rid of cellular waste for detoxification inside the cells, immune system function, repair, blood flow, circulatory system, O2, sleep and mood. There's a big job that thyroid function does. If you're pretty on paper, your blood work is okay, but your cellular system is not, you can be clinically hypothyroid. We call those people secondary hypothyroidism or peripheral hypothyroidism. In some cases, we actually do medicate them for a short period of time. When patients tell us my energy is better, my sleep is better, I'm warmer, I lost weight on a thyroid medication, they are actually hypothyroid. Almost always what will happen is after a month or two of giving them medication, they start to show up hypothyroid in blood because there was two stories. There was the story in the blood, and then there was the story in the tissue, and their cells were not able to communicate with the blood. So they had a blood work that looks okay, but their tissues were completely hypothyroid. So we do kind of keep the thyroid in mind a lot, because mood we can kind of understand and get a hold of. Hormones we can kind of understand, and we're sort of familiar, by the time a woman's an adult with her hormones, but thyroid function bridges everything. It bridges those immune system, detoxification, energy. It's that cellular piece that is a bit more nebulous or hard to kind of pin down if we've got an okay function. So I mean, this will be saved, but these are some hypothyroid symptoms, and I won't kind of go through all of them. You can kind of review them if you want, but things like hypertension, heart palpitations, even issues with joint pain, vertigo, edema, not all of these things like the type of skin, like the mixed edema or the edema or slurred speech are always present, but things like the lateral eyebrow thinning are sometimes hypothyroidism. So there's very kind of key, sometimes when we have the palm, like the keratin deposits in the palm, yellowy orange hands, those are hypothyroidism folks. There are sometimes, more vague things like libido or bruising easy cognitive impairments. The brittle hair is sometimes very key, but even things like recurrent infections or I've had a couple of cases where thyroid was actually the cause for the infertility, but it wasn't a clean, easy case. So more hypothyroid symptoms, just because they're pretty significant. But there are ways that you can support that system. So we usually do a base test of these kind of, what are they? I guess 7 or 8 tests. And if the base test shows that a person is not optimum, then we look at thyroid. Or if the person's, the set of symptoms tell us, there is significant, symptoms in that hypothyroid checklist, then we do a little bit more pushing. A lot of times what we see is that the reference range for optimum is not held. So we have a tight reference range for optimum, and a lot of times the people are outside of it, but not yet considered hypothyroidism.
And this is blood work you can get done through your doctor, right? I think there's different ways to use laboratory testing, but the way that Krista uses it is to look at subclinicals, look at optimals, and also to make a plan and then track the outcome, right? It's quite fascinating. You can do this for kids too, but it's harder to get a lot of blood work in kids.
We usually make a plan and then test our plan in blood work. And there are things like inflammatory markers that are not okay, but they're also very testable. So if your CRP is at a 5, anything under 1 is optimum. Anything over 2 is cardiovascular risk. So if you have a CRP that's not okay, you can do something like called the Royal Vitamin C Carnitine and check within a month to 3 months to see if it's better. You've just decreased your inflammatory risk. And it's easy, not easy, but it is very checkable. When we're looking at our stress system, it's a very real system. It's called the adrenal glands. The adrenal glands are very much supported in exercise and stress, but in exercise, there's the good support. We've got sort of the outside and the inside. The adrenal glands are the size of my thumb, and they're actually located above my kidneys, which are in the back of my body. The kidneys are not involved with adrenal or the stress function, but they're just kind of the location of the adrenal glands. And what we're looking at for the adrenal glands is 2 main areas of function. So one is cortisol, which is kind of your default gear. So we have a lot of, in my business, I hear a lot of bad things about cortisol, but too much cortisol or too little cortisol are not ideal. Too much is irritating and inflammatory. but also can irritate your sleep and your mood. Too little can actually induce autoimmunity. So it's bad for the immune system. We do know that the DHEA, which is a precursor for testosterone and estrogen, are also made in the same area. So when we're looking at cortisol function, we almost always use the DHEA marker. So DHEA does decrease as we age. When you're 20, it's around 20, and then as you age, it goes down. So when you're around 91, it's around 1. And so we've seen a lot of women come in and their DHEA doesn't match their age. I had a 30-year-old and her DHEA was 0.4. And I'm like, well, I have a 90-year-old that has a higher DHEA than you, but that's not okay. So we do want to make sure that stress is judged based on how it's working on your body. The other part, yeah.
Well, and just interesting enough for those folks who are active at the gym is that the exercise actually increases DHEA and it helps to regulate cortisol.
So because cortisol is high in the morning and then low in the afternoon, you wake up with cortisol. Cortisol gets you out of bed, loving life, and making sure that you're aware that it's daytime. You get a second little hit in the afternoon to remind you, day's not done, you got to keep going. And then cortisol naturally goes down in the evening so that you can have another hormone like melatonin initiate and maintain sleep. So that's one area of the adrenal glands. The other area of the adrenal glands produces adrenaline. Adrenaline is more known to be stimulated in exercise, which is great. That's the perfect spot for adrenaline. When adrenaline is secreted outside of exercise, it's the inappropriate time. So when adrenaline is secreted because someone just cut you off, or you're late, or your Christmas list is nowhere close to be done, or you've had a loss, or you're moving, like the body is not prepared to deal with the adrenaline safely in that way. And there's a cost to that. Adrenaline depletes magnesium and B vitamins, and there's a cost to being in that gear for a long period of time. That's where clinical burnout was discovered. But the harm that happens is not just kind of you pack it on. There's a cost that happens from being in the wrong system. So I kind of say your body's like a bus and it can only have one driver. Cortisol is supposed to be the dominant driver in your day. If for whatever reason cortisol gets shoved out of the driver's seat and adrenaline goes into the driver's seat, he's kind of rough on your bus. He's like gassing it and braking it and like swerving into lanes, and he's a bit wild, definitely drives too fast, definitely doesn't pay attention to the traffic rules, and there's always risk when he's driving. So what you want to do is make sure you're always taking adrenaline out of the driver's seat or putting it in its time, which is like, if you're a racer, you drive in a racetrack, that's where adrenaline is designed to be. Otherwise, cortisol drives the bus of the body. So exercise is one of those times where it's appropriate to secrete adrenaline. It's safe, it's good for the body. It does all the things that exercise is supposed to do. But outside of that time frame, adrenaline is actually an inappropriate response. And we want to protect the body from it.
Methylation and B12 break down the adrenaline, right?
Yeah.
So some people, I know, you exercise and then you can't get to sleep, or you exercise and then you feel exhausted later on in the day. You can help yourself have a more successful exercise regime by taking a look at your hormones, your adrenals, your methylation. It's all about improving your overall performance. That's, work, mood, energy, sleep, working out.
The majority of the people we see are are geared by adrenaline. I mean, it is common to have adrenaline. We live in Ontario. We have a very, our family lives out east, and they don't understand us at all. They think we're so strange. We talk too fast. We're so uptight. They're like, oh, y'all are from Toronto or from Ontario? We're like, yes. And they talk so slow. I just want to go faster. Like, when are you going to get to the end of your sentence? And so, we do live a different speed. And so we're always used to being potentially more in the adrenaline fight or flight mode, which means we're going to be low in magnesium and B12 or methyl factor because we make too much. And exercise is the perfect time for that, but outside exercise is not. So typically, magnesium deficiency symptoms with things like eye twitches, calf cramps, muscle vesiculations, even heart palpitations. I had a buddy came in and he said he had chest pain. And he was like, this was years ago. So he's like 30. I'm like, you're magnesium deficient. He's like, no, I have chest pain. I'm like, did you see the doctor? Yes, I saw the doctor. Did you get a stress test? Yes, I got a stress test. So your heart is fine. Yes, my heart is fine, but I have chest pain. Can you just take magnesium for 2 or 3 days and then, make sure that it goes away? It was magnesium deficiency because Magnesium is important with lots of things, but it's also stored in your big muscles. So magnesium causes relaxation and calcium causes constriction. Magnesium deficiency will cause too much spasm and constriction. So lots of magnesium, and people who live in Ontario will live in the fast lane.
And when you're stressed, your magnesium just evaporates. I mean, it's like the third or fourth most common mineral deficiency. And so if you're having these symptoms of stress or adrenal fatigue, like you need to look at taking like a B complex, magnesium, vitamin C. You need to lower your sugars, take protein with every meal, and fats. Like fat is the currency our body runs on. So that's the way you can help your stress system perform. I know when I was working out a lot, and I need to get back to it, so this is a great reminder, but when I was working out a lot, I actually was so tired by the time my kids got home that I was really struggling, because the exercise in the morning felt good, but I was so exhausted by the time my kids got home, and it was tougher for me to sort of get the stuff I needed to get done, be patient, get homework done. And so the adrenal support really helped that. So, you know, think about the timing of when you have energy, when you feel stressed, when your mind is racing, and know that your body is trying to tell you something. And maybe you, through, you know, listening to Krista, don't, you know, you don't know it's thyroid, you don't know it's hormones, you don't know what it is, but there is a way to figure it out.
It's not that hard. And typically the body's really good at telling you. And sometimes we're used to just, sucking it up and going on. But at the end of the day, your body is not supposed to be tired. You're supposed to sleep well. You're supposed to digest well. Life is supposed to be a bit easy. I know life isn't really easy, but your body is designed for optimum function. It's designed like a machine. It's very efficient. And when it's not efficient, there are ways to make it efficient, and they're not that hard. And when you apply an idea, expectation is that you see that idea work within days to weeks, not months to year. So some of these ideas we're used to seeing, we're used to sort of putting in simple ideas, but we're also kind of used to expecting really quick responses. This is just a quick little test result of someone's cortisol curve, where it's high in the morning and then it kind of goes down as the day goes on. So I think we talked about this lots, but the piece we find in this clinic is these are kind of our core supports for multiple reasons. I think we do find a lot of people nutrient deficient, and it's hard to be really good at your foods, even if you're good at your foods. We live in an area where the soil gets depleted really easily, where, you know, some of it's the perfection for food piece is always a grind. More greens, more good fats, protein, you know. There are different diets, there's intermittent fasting, there's paleo, they all have their benefit, but you also have to use your brain and sort of think like, why am I doing this? And is it making sense for my body, and judge it? Is there an outcome that is of service to me? And we use the diets and the different interventions all the time to do our job, but it's usually individually assessed because everyone has individual unique needs. And a lot of the people we see need more support. They need more power, not a restriction in food.
Well, they also, like when you look at elite athletes, right? Elite athletes are using these supplements and dietary interventions to elevate their performance and prevent illness, to prevent concussions, or to recover from concussions more quickly. I mean, these core pathways are very much involved in many aspects of health.
And even the digestive system. I mean, Sonia and I are pretty obsessed with the digestive system. We talk to our patients a lot about stool, so much so that our patients actually know there's a chart called a Bristol stool chart.
I have it up, but you won't let me share. You're like taking over. This is like my entire life.
You see how it means? You see how it feels? I won't share. Do you want to show the Bristol stool chart?
I do, but I couldn't because you wouldn't let me.
Oh, wait. Okay, there we go.
Let's see here. Now I don't know where it is. There we go.
That's not it.
Wow. There you go. Do your poop thing. Talk about optimal poop.
Okay. You need to make that chart smaller so they can see the 1 to 7 or whatever. Yeah, there you go.
So bossy. Oh my Lord.
Good.
It's good if she's bossing you around for your health, but can you imagine if she's your sister? Wait, Lord.
So optimal digestion is your bowel movement should be from your fingertips to your elbow or your wrist to your elbow, and they should be the width of your OK symbol. You're OK with your index finger and your thumb. That's the width of the optimum bowel movement, and you should have 2 to 3 times a day, in and out of the washroom, no gas, no bloating, no undigested food, and it should feel like you're empty. So that is an optimum bowel movement. A big part of people that would come and see us would have fecal loading. They'd have old stool impacted on the inside of their digestive system. And keep in mind that the digestive system is what you have access to. So you put something in your digestive system, and those pipes, you can sort of access the care of your digestive system. Sonia can go on for the whole entire night about the microbiome, but I'll just say before she cuts me off that the serotonin and things that keep us happy, 90% of your serotonin is made in your digestive system. So when we're looking at mood issues and we're constipated, or we have lots and lots of diarrhea, then we know that the serotonin is going to be not made in an appropriate way. The inside of the digestive system is also where a big, huge part of the immune system is located. So it's called the GALT system. And your small intestine is 20 feet of tubing. Your large intestine is 4 feet of tubing. Inside those pipes, there is a type of an immune system that controls that you have access to. So that immune system is responsive to diet, that even is fast responding up to 1 to 3 days. So you can have a support piece for your immune system very quickly. White sugar will tank your immune system by 50% in like 1 to 4 hours, son.
Yeah, it's 1 teaspoon disrupts immune function for 5 hours.
Yeah.
It can reduce it, or it can drive you into overdrive if you have a propensity or risk for autoimmunity.
So the food piece is a huge piece for the digestive system, but so is the power. So when you're looking at cellular support, when you're looking at efficiency, that digestive system is a real leverage for optimizing your health and optimizing your exercise, getting the most out of the effort you're putting in. I thought you were going to take over.
I can, sure. I mean, you kind of stole a couple of my best lines there, right?
I know.
But, okay, you got to let me share. You got to stop sharing yours.
No.
Yes. The worst. So when we look at the immune system, Chris is right. I mean, the heart of our innate immune system is in our gut. So when you're, exposed to a microbe, we have different wings of our immune system. One says, "Oh, I've seen you before. I know what to do about you," in terms of antibody response. And then the other one is sort of just like a more protective, and it just reacts. So that lives in our gut. And what Chris was talking about in terms of the fecal loading is that we talk about things like, say, for example, yeast, or we talk about things like Clostridia in the gut, or problems in the microbiome. The microbes in the gut, there's 400 trillion good microbes, and there's 10,000 different species of microbes, and they have huge jobs that they do in the gut. They regulate immunity, they protect against autoimmunity, they protect against chronic and acute infections. They help to detoxify. A lot of the questions we'll get from families, in terms of detoxifying harmful substances, they come out through the gut. So if your gut is not working properly, it's very difficult to deal with this toxic area that we live in. And your gut absorbs nutrients, makes nutrients, including fats and zinc. So again, I go back to this COVID piece, is that COVID has thrown people's health off in a really significant way, because it leads to significant intracellular zinc deficiency. So zinc is part of so many different important reactions, 200 enzymatic reactions, and it helps a lot in methylation, as I touched on in the beginning. Zinc deficiency is probably what we're seeing now, as there's so many people sick in the last few months, because their zinc inside their cell is so low. And because COVID itself is inflammatory, now the zinc can't actually be replenished. Even if you take zinc, it can't get inside the cell. And so you need a special bridge to get zinc inside the cell, and that's called quercetin. That's why Krista had it on our list of favorite supplements. Quercetin sometimes is used for allergies. It's very safe for kids and adults. It allows zinc to get into the cell so that you can actually replenish your intracellular zinc level. And a lot of the long COVID symptoms we're seeing are related to zinc deficiency. I always say that the gut is the miracle drug. And the reason I showed you that picture of the clogged pipes is that if you have a bunch of old junk inside the gut, then it will disrupt the production of serotonin. It can throw off sleep. It will create stress. It will create inflammation. It will create oxidative stress, which is where it pokes little holes in your cells. And then your methylation cycle has to work even harder to fix and repair all that damage. When we look at sort of the absorption piece, one of the things we like to do is actually to get a bowel x-ray. So a bowel x-ray can take a look at how much stuff is stuck in the gut, and I'll sort of just show you that clogged pipes again. But this is something that we're using more and more, rather than just guessing what's happening in the gut. We're running, with the help of the physicians, bowel x-rays to see how much junk you have stuck to the gut wall. So because we have about 15 minutes left, and I do want to leave some room for questions, but I want to just talk to you about just a scenario, right? And Krista mentioned this, but let's say you have yeast overgrown in the intestine. Yeast overgrows in the small intestine, and it can lead to yeast infections. Obviously, that's in a different system, but the microbial problem really resides within the gut. So if you have chronic infections, whether it's yeast infections or UTIs, cold sores, anything that you have, the problem is back to the gut, chronic fungal infections. So let's say you have yeast in the small intestine. You're not going to be able to absorb things like B12. You're not going to be able to absorb fats. You're going to start depleting things like vitamin A. You're going to start depleting things like zinc. And yeast actually depletes B6 to the point where it will impair mood. So you'll have lower serotonin, lower dopamine, and you'll have an increase of something called glutamate, which causes actual physiological and biochemical stress on the brain. So we can be personally stressed out by stuff, but I'm talking about stress that's coming from inside your cells because your cells are going haywire. Yeast then can actually deplete biotin, which is like a B vitamin, and you need biotin to make cholesterol. So now you're in a situation where you don't have enough cholesterol, which Krista says is the queen of the fats or the king of the fats. So now you have downstream hormone imbalance. You might even have acne. This is all just from yeast stuck to the intestinal wall. When you look at the importance of gut health, I mean, it really cannot be overstated. The yeast lives in all of our intestinal tracts, but it feeds on carbohydrates, it feeds on sugars, and it thrives in a situation where there is stool that's slower coming out. So that could be overt constipation, or it could just be slow motility. So with the bowel x-ray, we can get an idea of how much stuff is stuck in there. And if you want to get a head start on this, tonight or tomorrow, go home or if you are home, eat a beet, cook it first, a medium or large size beet. It can't be beet juice, and count the number of hours until the red color comes out in your stool. Keep counting until all the red is gone. You should see the beets come through your entire digestive system within 24 hours. If you're still seeing that red color, 72 hours, 3 days, 4 days later, you have very slow transit time. And so slow transit time will lead to junk in the pipes. That's why we use this pipe analogy. Something like yeast can wreak havoc on methylation, on mitochondrial production of ATP, on inflammation, and certainly on hormone regulation.
Son, you want to stop recording, then we'll take questions?
Yeah, for sure. There was one other, I was going to show the IGO pathway, but do you think we have?
Yeah, do it.
So one of the, Krista talked about the fragility index. So pathway planner, let me just, the fragility. No, I got it.
Okay.
Oh my gosh, look at this. I'm taking away your ability to share. This is nonsense.
You were slow.
When we look at methylation, you can sort of break it down into genes. And this is done by Dr. Ben Lynch. He's in the US. And this is a phenomenal sort of overview of our genetics. And keep in mind that our genes are not static. You don't just get all your genes and they stay the same. They can work really, really well, or they can work slowly and inefficiently. And so this set of circumstances determines how well your genes function. So here we go, restful sleep, community, real foods. I don't know if you've got exercise even in there, but that's a huge miss if he doesn't. Exercise improves your genetic expression. When I talk about methylation, and this gets really detailed, but it's actually quite fun if you look at what the body will do under stress, is if you don't make enough serotonin and you have, say, something like chronic infections or stuff sticking around in your gut, you go from what we call promised land over here, which is making lots of nice dopamine and lots of serotonin. Keep in mind that serotonin makes melatonin. So if you're not sleeping properly, that can be a gut problem, and often is, particularly in children, which I understand a little bit more about. But what happens if your body's under stress is you go into chaos land. And chaos land gives you the physiological biochemical stress in the body. This pathway is called the IDO pathway, and it's linked to everything from Alzheimer's to autism, chronic stress, chronic infections. So if you're sort of stuck in this mode, you can't get out of chaos land. And chaos land can be panic, anxiety, it could be tics in kids, it could be autoimmunity, because if this system becomes really dysregulated, the body starts actually attacking itself. And so when you're in chaos land, your normal immunity doesn't work, your normal production of serotonin and dopamine doesn't work, your normal production of melatonin doesn't work, and your normal production of glutathione. So glutathione is something that you may have heard, but if you haven't, this is the most important antioxidant in your body. It's made by B6, it's made through methylation, and it helps to break down estrogens. And so that's how methylation is really critical to hormone balance, in addition to the production of serotonin and dopamine. That's one of the reasons we love B12 injections. B12 injections actually take you out of chaos land, and they push you more and more towards the promised land. They actually have been shown in studies, even in kids as young as 3, to improve the production of glutathione 100% safely. It's water soluble, it's non-toxic. So again, I don't treat a ton of adults, but if I had, say, a young woman, an adolescent, well, they'd probably be booked with Krista. So let's say I had like a 10 or 11-year-old and they had anxiety or depression, we could safely treat their body to improve serotonin and dopamine, to either improve the anxiety depression or be an adjunctive treatment to the medication that is recommended. Because keep in mind that medications for mood don't help you make more serotonin and dopamine, but you can do that through exercise, through improving sleep, improving diet. And so that's why we love this biochemistry. I don't know if you want to say anything about that and start sort of taking questions, but my computer's about to die. I'll be right back.
So I think, where's our last? I think so Sonia was a keynote speaker, like on our 3rd trip to China. She was asked to speak in Beijing on a conference on Alzheimer's, because her patient base is all IDO1 pathway. She sees only kids on the autism spectrum, and they are all IDO1 brain inflammation. But research in 2019 actually showed that the IDO1 inflammatory pathway could trigger Alzheimer's. So that's why she was asked to come and talk, because she knows the IDO1 pathway really well. See, now I don't have my cord, I'm stealing yours. I'm stealing my cord. She's stealing my cord. So when we're talking about the IDO1 pathway with the brain inflammation, it's maybe about 20% of my practice, but it's 100% of her practice. And so she's really good. She's really good at that brain IDO inflammatory piece. But as it relates to exercise and function, it's very hard. It's not hard. There's a specific trick to turn it off, the IDO1 pathway. So these are our base nutrients for suggestions. And those are some of the reasons why. I know we kind of like the biochemistry, which can sometimes be boring, but that's kind of our shtick on exercise. Is there any questions? I don't know if I can figure out even how to answer questions.
Well, if you put the questions in the chat, I can see them, or you can just tell us what your questions might be.
I think I keep on minimizing the screen.
So the one thing I will say is, say you start taking any of those supplements and you don't feel well, you feel nauseous, you feel tired, you have diarrhea, you're not sleeping as well, your skin breaks out, that is your body telling you something. So we don't want that to happen, but that is not a dangerous thing, that's a communication. So when I took Chris's maternity leaves, because I don't treat a ton of adults, but I tried to be up to date on all the things that she was focused on. So at that point, there was a lot of hormone issues in her practice. There was a lot of fertility issues. So I recommended B12 injections because it helps to regulate estrogen. And so, a handful of Chris's patients started to get acne. And of course, as an adult, getting acne is not very fun. It's really not fun as a child either. And then Krista would explain to me, no, this is the body detoxifying estrogen, but it's not coming out through the gut. So you need to do this, this, and this. So you remove the unhealthy estrogen. And so I felt, when you take someone else's practice, it's a huge responsibility, but she's like, no, this is good because you're actually getting rid of the hormones that cause breast cancer. And so if your body does something with a supplement, it's not scary. It's not like only negative, right? It's a communication, it's information. Some people take carnitine and they feel really sick or they get a ton of diarrhea. Some people that I treat, they'll take fish oil, they get nosebleeds. That's because they're not absorbing. So naturopaths who've been practicing a long time take this information and they say, okay, what does this mean about your body? But we're no longer, in our younger years, so we're not afraid of these things happening. We want results for your body. We want them quickly. And if something happens with the supplement, keep in mind that your body's trying to tell you something.
Anyone have any questions? Ooh, that's easy. I like it.
Yes, I do.
Okay,
Are
awesome.
you ladies currently, do you only treat children, or are you currently taking on new clients at the moment? I'm one of the personal trainers.
Oh, nice.
So I know I have a few clients inquiring about NDs and all that. And are you taking on new clients at the moment or no?
Yeah, Krista takes adult patients, and I really, if you call the clinic and ask for me, the staff would be like, you want to see Krista if you're an adult.
Okay.
And I sometimes have moms who want to stick with me, and I'll get started, and then I'll just sort of say, I'm going to ask Krista about this. I'm going to ask Krista, and even with my own daughter, right? Once she hit puberty, I had to go and talk to Krista, and she's helped us figure out all kinds of stuff, which is amazing.
Perfect. Okay, good to know because so I would say 3 or 4 of my clients are currently going through some fertility treatments. So I was curious on both your ends or one of your ends on kind of just the whole ordeal of, I know asking the basic question of like, how does infertility happen? Like, can happen for different people for different reasons and all that. But what is your, I guess, main opinion on like why infertility happens? Is it mainly through like the thyroid? Is it other things happening? I was just curious on what your take is on that.
Yeah, every case is different. I mean, we've had, because I mean, my son and I have been practicing for almost 20 years. So, I mean, we've seen lots of cases with lots of things, but typically fertility is something, right? It's usually something, and it's usually going to show up eventually. Typically what we do is get as much lab work we can, but also take a really clean case. Almost always will be a hint in the case. There'll be a hint in the intake. That's why the intakes are so long. We have about an hour of an intake. Almost always the person, if you do a good enough intake, will tell you a little bit about something that is going to be a problem, but typically it's toxicity. Like, we don't live in the cleanest area. So the more toxic the area, the more the person, and the genetic, so that the 3 pieces are usually genetic predisposition, toxicity, and then something going on with hormones or inflammation. But a lot of those are testable.
I also, even though I don't treat fertility, again, when I took Chris's practice and when I have talked to other naturopathic colleagues, I mean, the literature on sperm health is really like, we talk a lot about women's sort of contribution or risk factors, causes of fertility issues, but honestly, the sperm piece is huge. Like 50%, correct me if I'm wrong, Krista, but 50% of fertility issues are solidly sperm motility, sperm quality, sperm morphology, and they've actually dropped the sperm counts in North America. So like 50 years ago, 75% of the men tested would be low.
Wow.
So they've actually dropped the sperm count. So a lot of women are going through this and they're so stressed and they feel so awful. And one of the things that I have always encouraged you, if I'm working with a family or if I'm, referring to Krista, is like both people have to be involved. And sperm health is a lot easier to optimize than the complicated hormonal system.
Right.
Yeah, it's 50-50. So I actually won't take a case on and call it a fertility case because I do have a good reputation in this area with fertility. So I won't take a case on and call it fertility unless I have both people, not at the same time. If a woman wants to come alone, we'll do a general visit, but I will not label it a fertility visit because it's not, I don't know the full picture because it takes 2, obviously, unless there's a donor involved.
Right. Okay. That
It's
completely
50% of the time. And sometimes these guys look great, they look healthy, and then we get into it. And I have had so many of the partners come in and like, I only sleep 3 hours a night, and like I've got whatever, and I'm like,
yeah. And
the
sperm health too now in men's health is being used outside of fertility to assess their own well-being and risk factor for disease. So it's very interesting. I know it's not necessarily something you always expect in a women's fitness talk, but
but I agree. Like it's part of it 100%. And it's just, it always, with all the clients that I see and I talk to throughout the day, it actually amazes me how many, back to the women part, how many women have fertility issues. Like it blows my mind. And then I guess another sub question to that would be, is it partly due to the environment, that toxicity that you were talking about before?
Yeah.
Yeah, I think it's 1 in 8, right? 1 in 8 Canadian couples have trouble conceiving.
Yeah. And the toxicity piece is like, it's too sad. It's too much. Like my background's in biomedical toxicology. I went to Guelph for 4 years, and that's my undergrad. And Sonia won't even let me talk on it anymore because she's like, you just talk for an hour about how things can kill you. And I'm like, I know, but it's so interesting.
But
It-
the other thing that's I want you to focus, you could talk all day about all the toxins, the thousands of toxins that negatively impact human health in addition to like including fertility, but the body is amazing. Like when you can look at something like whether it's severe autism or Alzheimer's or arthritis or, you know, any of these issues, the body typically can significantly improve. And I often say, like, if you give Krista enough time, because of her undergrad is a biochemistry undergrad, and so she learned how toxins negatively impact human biochemistry. If you give her enough time, she can figure out anything. Like she's so well known now with the naturopaths. If they don't know how to help it, or if it's something they've never heard of, they send their patients to Krista.
I get the tough cases. I like the tougher cases, but I also I have a general practice. So I take a lot of tougher cases, but hormone, you know, after a while, we don't actually expect everyone to be a tough case. Sometimes there's some really nice, easy supportive things we can offer that are very easy to implement. They work really quick and they have a huge impact on health. And it's just because, you know, we've done it for so long that we can pinpoint where we're of service.
Well, and that's the fascinating thing about the long COVID piece, because I do have a practice that's very focused on autism and developmental delays, which is all brain. But because long COVID is brain, a lot of the stuff that I would use in autism treatment is being used very successfully in long COVID treatment.
Yeah.
Oh, wow. That's cool.
Yeah. And concussions, because I can't get my 15-year-old to stop getting his head hit at hockey. So
He leads with his head.
good. Thank goodness he's Polish. He's got a nice, strong head.
Oh, I'm Polish as well, so I could totally relate to that.
I can tell you're gorgeous, right? And that's when I say to my kids, it's like that extra support's really helpful.
Well, thank you, ladies, for answering my questions and for tonight. That was awesome.
Thank you, everyone. Have a great night.
Is anyone else, or are we good to go?
We're good.
Okay. Okay. Thank you so much.
Thank you.
Take care. All right.